morning. Can you hear that? Is the audio working fine? Yes. Yes, okay, great. Thank you.
The conference has been muted.
We're going to go ahead and get started this morning. My name is Melanie Plusinski. I'm the Policy Programs Manager at the American Indian Cancer Foundation and on the Technical Assistance Contract to be supporting tribal SHIP grantees. So this morning we have our Executive Director, Kris Rhodes. She's presenting on American Indians and the complex relationships that our communities have with tobacco. Kris will share how these relationships result in different outcomes for American Indian people. She will also share some of the most promising and innovative tribal and urban efforts to address tobacco issues in our community.
Thank you, Melanie. Hello, everyone. I'm happy to be here this morning. I'm going to start out with an introduction. Buju anin nindinawe makani duk. Chiakwe nindagu Anishinaabe Moen. Idash Kris Indigenous Chagana Shmug, Makwa Nindudea, Miigwech Mizidawe. Thank you for allowing me to be here today and I'm honored to be a part of this webinar on behalf of the American Indian Cancer Foundation and with all of you participating on this call. We're really eager to share some information and hear more about what it is you all are doing as far as questions. Thank you, Melanie, for getting us started. So today we're going to talk about tobacco in Indian country. We said we're going to talk about the good, the bad, and the ugly, and I'm hoping that you can all discern between the good, the bad, and the ugly in the presentation. You will see it all throughout. What we're going to talk about today is an overview of American Indians and tobacco. I'm going to talk about traditional tobacco use and share a little bit about tobacco addiction and the burden of tobacco addiction in our communities. We're also going to talk about incidence and mortality data when it comes to tobacco and oh boy. Start over. Are we having problems with audio? Yeah. Oh, I have to call in. We're pausing for a moment. It looks like some people cannot listen to the presentation. You will need to call in to the audio controls, and you can do that by clicking on the button to do it through your computer, or you can click on, there is a phone number, so if you would prefer to be able to connect by phone, there is a phone number on there that you can click. It should be on your screen. I will continue to go over the overview as we are talking about what we're going to cover today. And in the end, again, we'll have time for questions and answers. And we're planning to leave at least 15 minutes for us to be able to do that. And I hope to have a really engaging conversation in the chat box. And we'll be able to try to manage that over this call, this webinar. So I'm wondering, first of all, what does tobacco mean to you? And for us as Native people, tobacco is has many different it comes in many different forms. And we use it in many different ways. The traditional uses of tobacco are spiritual and they're medicinal. Some of us use tobacco on a daily basis, and that doesn't mean that we're always burning it or inhaling. In fact, the most common uses of tobacco for spiritual and medicinal reasons include offerings to other people when we're asking for information and advice. Tobacco is sometimes placed in the water or in a fire. And of course, tobacco is used in our ceremonies and in our pipes. And I will not talk about that at this point, but this quote is on the slide is really talking about, tobacco is like any other medicine, and when it's used correctly, it has the power to bring good things. And like other medicines, when we don't use it correctly, it can bring great harm to us. And that's always what we remember when we're talking about tobacco in our communities. When we have good relationships with our tobacco, we really, the positive things that come into our lives, I've seen it happen over and over again, is tobacco can bring really great things to our lives. And I've also seen the other end of that when tobacco is misused. And I know you all have as well. So what is in your tobacco is another thing. And we talk about, there are many different forms of tobacco out there. And it can be kind of tricky to explain. And to those of us especially that don't work in tobacco every day, that term commercial tobacco may be a little confusing. But commercial tobacco is tobacco you buy in the store, sometimes also called packaged tobacco. It includes loose tobacco, it includes cigarettes, it includes chewing tobacco. And when we talk about traditional tobacco, what we're talking about is the tobacco that's usually not bought in the store. We're talking about that Indian tobacco, that mixture that may or may not contain any tobacco at all. When we talk about Clinicians or Cessation, we're talking about the tobacco that has centuries of protocols that go with it when we're gathering that tobacco and using it for our spiritual and medicinal use. The photos on this slide show some of our traditional tobacco, Asema plants, on the far left, from the little baby seedlings, which we'll be seeing here soon once the snow goes away. And then later in the summer, before they harvest, those plants can get to be about knee-high usually. And there's some of the plants drying there on the fence. Over on the right part of the screen, you'll see the red willow and the kinnikinnick. And I've seen, I haven't gone out yet, but I've seen people out and about gathering the red willow bark in preparation for the kinnikinnick. And that's something that I hope is that you all have the opportunity to be involved in, is these different learning these strategies about how to access these tobacco plants, because when we're talking about using tobacco in a good way in our communities, this is what we're talking about. We're talking about learning about these plants and using these plants instead of going to the store and buying that convenient package of pipe tobacco or cigarettes. And so we see more and more action moving in this area, and I'm excited to hear even more. This slide is talking about, why are American Indian tobacco issues so complex? And it just really touches on some of the issues, but I just really want to, we have to be mindful that when we're talking about the high rates of tobacco and our addiction in our communities, we cannot forget that we have to go into context with all of these things that are facing our communities and have faced our communities. First of all, the lack of religious freedom didn't happen until 1978. Many of us, or some of us on this call, were actually, that was after we were born. So we were born in a time when the use of traditional tobacco wasn't a religious right for American Indian people. It's real recent that we're regaining these practices. And so some theories that I've heard from elders that I've talked with is that, or it's not theories, this is the way that it is that in order to continue using tobacco for ceremonies and in healing practices, that cigarettes were substituted as a way to hide in plain sight. And that's where we see when we think about when we go to funerals and wakes, I don't know that there has always been cigarettes passed out at those ceremonies, but I think it was a way to continue that practice of sharing that asema, sharing that tobacco in a way that wasn't going to get somebody in trouble legally, potentially. We also know that tobacco addiction is very clearly tied to trauma, stress, and when we think about a community or population that experiences elevated levels of stress and trauma, we have some examples here of how we can't deny that has happened historically and continues to this day when we think about the loss of culture and family and the economic issues that our community faces. In addition to that, we have the imagery on tobacco products and how wrapped up in how warped in American Indian identity that is, being that it looks like these products are targeted to us or for us or by us, and they really aren't. They're being made without us and for profit outside of our communities for the most part. With the high rates of smoking we see in our communities, it has become a social norm to continue smoking, and quitting is hard when you're in an environment where everybody else is smoking. And we'll talk more about this as we go along. And you'll see, we see the commercial use has now been woven into many of our cultural practices and ceremonies. We already talked about the funerals and the wakes. We also, our most sacred medicine dress is, the jingle dress is made with the lid of chewing tobacco. And so we really think about how does that happen, and then how has commercial tobacco, again, woven itself into our ceremonies and our healing practices. This picture is, again, it just shows the extent, or some of the extent. I believe there are hundreds of American Indian chiefs, tribal leaders, that are featured on commercial tobacco products that where there has been no permission. There certainly is no royalty going back to those families. And we have to remember that this is really taking advantage of our communities. And I've been excited to see some of this is an activity that young people get really excited about. They can get really fired up about taking on the imagery, the native imagery on products. And so we'll talk more about that. So what do? We need to put out the biggest, single biggest killer of American Indians, and that is our commercial tobacco. And that's Indian killer cigarettes, to steal Sherman Alexi's title. But we know that cigarettes are killing 2 out of 5 American Indians. It's not if they are killing our people at this point. We have the data. We know how harmful cigarettes are, and it is the leading cause of death for American Indian people. When we look at the health effects of cigarette smoking, we know that smoking causes damage to every part of our body. There are a number of different cancers that are closely linked to cigarette smoking. Lung cancer being the most closely linked. 9 out of 10 cases of lung cancer can be directly related to cigarette smoking. The other cancers vary as far as the impact cigarettes have on them, but usually about 1 out of 3 cancers can be tied back to smoking. Chronic diseases, And of course, we have the health inequities in our community. We see the results of tobacco addiction blatantly in many of increased rates of many of these chronic diseases, from stroke to gum disease, heart disease. And we talk about combining smoking and diabetes. It's really a lethal combination that too often ends in coronary heart disease. When we look at cancer inequities, for Minnesota, we have some data on American Indian cancer diagnosis and mortality rates compared to white, and we have some serious problems. We have really elevated levels of cancer in comparison to the general population, and some of these are very closely linked to our high rates of smoking. These two slides, or this slide here, compares a map of the burden of tobacco addiction when we look at lung cancer death rates by county. And I guess the thing that was really the reason why I include them in my presentation is it was really striking to me to see these red counties, these counties with the highest rates of lung cancer are, to me, look almost like, these maps look like they could show the reservation boundaries in each of these communities. We see very clearly that these high rates represent our communities. And so it's just I thought it was a really visual representation of the lung cancer rates. These maps are not race specific, but are just the general age-adjusted lung cancer death rates for Minnesota and Wisconsin. And data has been an issue, and I know data continues to be an issue as far as knowing the extent of the problem and where we're at in improving those problems. And so it's really important that we have access to good data. Two journals that we look to, if we finally have some good data on cancer incidence and mortality. Actually, the American Journal of Public Health, the one on the right, has death rates for American Indians on a number of different, on all different causes of death. I do encourage you, if you're interested if you're a data geek like me, to you can certainly contact me, or we can figure out how to get you access to these sources, but these really are great sources of data on American Indian rates across the country. And of course, these rates vary by region, by tribe, and gender, but are really very much more pronounced. I'll tell you that the smoking rates up in our region are higher than anywhere else, and our cancer disparities go hand in hand with that, of course. So briefly go into the American Indian Cancer Foundation story. Is the American Indian Cancer Foundation was established 5 years ago to address the tremendous cancer inequities faced by American Indian and Alaska Native communities. We are working to eliminate cancer burdens among American Indian families through education, improved access to prevention, early detection, treatment, and survivor support. Tobacco control work is critical to the work that we do. And our approach, if you've worked with anybody on the ACAF team, you'll know that we firmly believe that Native communities have the wisdom to find the solutions to any inequities or challenges that are faced. And what we try to do is to provide the organizational capacity, expert input, and resources to do so when and if that's necessary. If we can help make your job easier in doing this cancer prevention work, that's what we aim to do. But we know that that you all hold the wisdom to what's going to work, what works in your communities, and we're ready to work with you. I'm going to talk a little bit, I'm going to share some information on the Tribal Tobacco Use Prevalence Project. And this may be a review for some of you. Some of you were, I'm sure, interviewers in this project. Some of you have seen this data. This was a project that was conducted by the University of Minnesota in the School of Public Health and in partnership with 7 of the 11 tribes and the urban areas of Duluth and the Twin Cities. The project worked with tribal council approval. We worked with health systems, and again, we worked with, the interviews were conducted as in-person interviews using community locations, and made sure that there were gift cards and appreciation. The result was that there were almost 3,000 interviews completed in a 2-year period. Dr. Jean Forrester and John Poupart were the co-PIs of this study, and we have both of whom are retiring and have entrusted ACAF to continue to share the word and share these findings of the story. What I want you to know is if your community was one of those 7 of the 11 tribes, you should have a report of your own tribe-specific data that hopefully you're using to help understand the extent of the tobacco problem as documented in this project. What I'm going to share here is the statewide data. So we're going to jump right in. We're going to jump right in. So when we're looking at cigarette smoking rates, we looked at the data by current smokers, former smokers, and never smokers. The definition of a current smoker is somebody who has smoked within the last 30 days and has smoked at least 5 packs in their entire lifetime. A former smoker is somebody who has not smoked in the last 30 days and has smoked more than 100 cigarettes or 5 packs in their lifetime. A never smoker is someone who may have tried smoking but never has smoked less than 5 packs in their lifetime. So what we see is an overall current smoking rate in our communities of 59%. This is 4 times the rate of the Minnesota general population. When we look at the rates by gender, we see that men smoke slightly more than women, but it's really close. As far as our American Indian women are smoking a lot more than in other populations. And that has specific health effects going forward. When we looked at the cigarette smoking rates by age groups, we found 2 really interesting findings, and they're circled here. One of those is in that youngest age group, we have the highest rate of never smokers. And you may look at that and say, well, just give them time. They are the youngest age group. Of course, they have the lowest smoking rate. But what we know about smoking patterns is that people usually start smoking before age 18. It's pretty rare, especially in Indian communities. The age of initiation is even lower than in general populations. And so if they haven't started smoking by age 18, it's a pretty safe bet. So we're hoping that this trend continues, and we're looking forward to future surveys and future tracking of this data to see if that does hold true. I think the most disturbing or devastating finding of these surveys was this 70% current smoking rate for 25 to 44-year-olds. And why that is so devastating is that these are generally the age of parents in our communities. And so, again, it's modeling that behavior to the next generation, and that has obvious potential harms to it. The secondhand smoke exposure data from this survey showed really high rates of secondhand smoke exposure for American Indians in the survey when we compared to the Minnesota Adult Tobacco Survey. The rates were at least double in most community or in most settings within the community. Several times higher. We're talking about current exposure by car and by home and even in the workplace. And this is at a time after the Freedom to Breathe in Minnesota was passed. And so smoking in the workplace shouldn't necessarily be an issue. Quit attempts and plans to quit. We have limited data on where smokers are thinking about quitting. What we found is that 62% want to quit smoking. Only 24%, so 1 in 4 people are the ones that say they don't want to quit. But most of the others, so 3 out of 4, mean maybe they're not sure or yes, they want to quit smoking. And so I guess the takeaway message here is that we want to be able to have effective cessation programs available for those people who want to quit and be able to offer them something in that. And what we find is that even with quit attempts in the past year, less than half had not made a quit attempt, and more than half did, and some of them had tried to quit 3 or more times. That's encouraging because we know it usually takes more than one time to quit, and lots of practice to quit smoking, and but that's what it's going to take to get there. So related to that is the need for effective cessation options. And again, the preferred cessation options is really important because we do have cessation services available to some extent across, but are they even something that American Indian smokers want to access or use? And what we found is we asked the question, would you use the following for quitting if cost was not an issue? What we found is the highest percentage were for looking for nicotine patch, gum, and lozenge. Almost half of the people wanted that. And also the tribal teachings or ceremonies associated with supporting a smoke-free lifestyle. 42% they said they would like group or individual class or support. And we know that that is limited sometimes in tribal communities, but it is growing, and I'm excited about the fact that some of you all are leading those efforts in your communities. There was less interest in medications like Zyban or Chantix, and very little interest in quit smoking phone support or quit smoking internet support. So I think if those can change with more information and perhaps culturally appropriate services. But those are my opinions at the end there, so we'll see what that looks like going forward. Another opportunity, of course, is with healthcare providers' activity. We asked current smokers if their provider had supported or addressed their cigarette smoking with them. And what we found is there was a high percentage of providers asking if they smoke when they go to a clinic visit and advising not to smoke, but really little activity when it comes to recommending a quit smoking product, suggesting a quit date, or helping to access a quit smoking program, or arranging follow-up. And that's surprising because when we talk about the healthcare provider role, the tobacco use really does. This is a quote out of the 2008 U.S. Public Health Service Guidelines. I think that really resonates, and it's something when we do training and education with healthcare providers, I think really has a impact on providers, is that, there's not very many other issues where we have whereas we see a highly significant health threat combined with a lack of consistent intervention. When there is the presence of effective interventions, we know what can help support this, and yet providers aren't necessarily doing their role, and we know that things get busy, and there are lots of reasons why this doesn't happen. We're working really hard to make sure that it is happening every time a patient goes into the clinic setting. And really the role is the steps of the 5A model is really to ask advise, assess, assist, and arrange. I know that many of you are working with your clinic teams on this, and I encourage you to continue that work. They offer another way to support these messages in our communities, and they often come, we know that it seems like providers wear a superhero cape when it comes to handing out information, and so we want to make sure that they're doing their job to the best of their ability, because that really can impact whether or not a person takes on a quit attempt. We have a program here at the American Indian Cancer Foundation called iQuit that is working with several of the clinics across the state, working with the clinic teams to implement this 5A model in your settings. And so if that's something you're interested in, please do follow up with Melanie and Peggy after the presentation. So after all that data, so that was it. That was my data smudge, as we call it, those numbers and data. Smoking is a public health crisis for American Indian people. That is clear. It is linked to almost every single health indicator, and it's closely tied to all of the leading causes of morbidity and mortality. But again, remembering that tobacco in our communities is very complex, we must remember to keep it into context. We can't just expect that we're going to offer patches to people and that's going to solve the problem. We have to remember that the trauma plays a role. The stresses that are ever present in our communities play a role, and we can't ignore that when we're talking about building a comprehensive health and wellness program in our communities that helps people use tobacco in a positive way. There are effective solutions out there. We strengthen the effective solutions out there are focused on opportunities to strengthen youth understanding of the positive and harmful uses of tobacco. We see this happening in youth groups and in educational settings where we're talking sharing those teachings and engaging youth in that understanding how tobacco is used by our people, and to really do that tobacco prevention work. It really goes hand in hand. We are looking at decreasing youth access to cigarettes. We can do that through policies that look at age of purchase in our communities, as well as price. Price is probably one of the biggest impacts when it comes to whether or not people will share their cigarettes. I mean, we all want to be really generous all the time and share what we have with others. When the cigarettes get more expensive, the data is there that says they're less likely to be shared. We need to improve cessation options for smokers in our communities. I've talked a bit about that. And we need to encourage and support policies for smoke-free environments. Again, I know that so many people on this call are working on all and some of these angles of these policies. I'm really excited to share with you today this new, hopefully there's a big gasp and sigh, because that's what I did when I saw this. I want to give credit to Melanie Plasinski and Jessica Harjo and Amanda Dion and some others that are on the team here at the American Indian Cancer Foundation for developing this great graphic. And it really is about educating and thinking about sacred tobacco use, what that traditional tobacco use looks like in our communities, and why we can't just focus on one piece of that. If the only thing we did was focused on a community tobacco garden, that's great. That's an important part of it, but it's just one piece. And so this really ties together, I think really shares the way that we really work together for a balanced community when it comes to how we address tobacco in our communities. We will make these available. These will be shared far and wide. You should be able to download them on our website very soon, and we can also print copies and get them to your community. If it is what you like, we're eager to hear feedback from you as well about what you think of these. We're really proud of them, as you can tell. When we talk about, there's a lot of work out there, or, a lot of the reference resources that we have right now are not necessarily specific to our communities. And we have to remember that as Native people, we have that our values, if we really rely on our values and use those in how we do our work in our community, we're going to have a far greater impact and be able to reach people more quickly. And so I included some of these on the slide for just as a reminder. And the quote on this slide comes from an elder. We had an elder gathering here, and I thought this was really powerful that one of the elders had to share that we're not looking for programs to fix us, that our strongest assets are our spirituality, our healing powers, our culture, and our family system. And that's true when it comes to looking at tobacco. It's not necessarily about having a program in our community, but to be able to have all these things in place that really support who we are as Native people and how we do how we live our everyday lives. And if we can do that in a way that allows us to use tobacco in a good way, and maybe makes it more inconvenient to use tobacco in harmful ways, and really supports us figuring out how to end that addiction. When we think about strategies for successful tobacco control, we always use the resources that are available from our mainstream partners. We have Clearway Minnesota, who does some really great work, and they're really engaged. Coco and Jamie are really working really hard to engage communities and make sure that these resources reflect our communities and involve our communities. We also have resources and programs available through the Minnesota Department of Health that is doing great work, and you all have contributed to improving the way that Minnesota Department of Health is delivering tobacco support and supporting you all in your efforts to do that. There are other partners out there that are really doing this. And then we take them and we just, we have to tweak them. We have to make sure that they fit who we are as Indian people. And so we don't do that on our own. We do that with lots of discussion and talking and prayer a lot of times, and to get to a point where we feel like these resources fit our community. Our resources need to focus, they need to always include language that supports spiritual tobacco use when we're talking about the education of others and the access to this traditional tobacco use. And so not using the resources that just talk about, I've seen educational resources that say tobacco kills, and that's offensive, of course, because it doesn't always kill. It depends on how you use it, right? I'll keep seeing that throughout this. Media messages are super powerful in our communities. It's been really great to drive around and see more and more billboards out in our communities, like the example here with beautiful little Kailela, and on the billboards in your communities. I've seen them around the diabetes programs as well. I think we remember that we have some local media options as well. When we talk about tribal radio and tribal newspapers, let's remember to include the tobacco messaging when it comes to these. And again, we're trying to normalize the positive relationship with tobacco for our communities, and change that social norm that's tied to Indians smoke cigarettes, or that in order to be seen as an Indian, you smoke cigarettes, because that doesn't necessarily have to be the way it is. We need to be able to offer better cessation support. We can do all this other stuff that really promotes traditional use and good work in our communities. But again, we have to remember that we have more than half of our adult population is addicted to cigarettes. And in order to end that cycle, we need to be able to offer effective cessation support. We need our healthcare providers to be asking and advising. We need them to be referring people to effective cessation programs in our communities. And we need to make sure that people have access to the medication that we know works, that it's the nicotine replacement therapy or whatever, that can help people quit smoking. We know that that is an effective means to offer long-term cessation. Policies for tobacco control, when it comes to price, clean air, and youth access are also options. I know that you all are encouraged on a regular basis to focus your efforts on making sustainable changes, and policy is the most effective change that you can make. Of course, it's challenging sometimes in our tribal communities where many of the elected leaders are addicted to tobacco and may feel like you'll face some opposition, but remembering what to involve the community and finding out what the community wants is the important thing, and involving youth and elders in your campaign and seeing which of these are most appropriate for the work that you do and for where your community is at. And of course, the data and evaluation. The data and evaluation are key. They may not be something that everybody's interested in doing or managing, but you need to have somebody on your team or somebody you're connected to that is measuring what you're doing, because it's telling your success story. And without that, other people outside your community may not continue to fund the efforts. You may not know how successful you've been. You may have some stories about that, but you don't necessarily, you need to have that data and evaluation to be able to tell your success story and to know what works. When we look at community tobacco control and how to put it all together, it can be overwhelming sometimes. I was the one and only tobacco person in my tribal community when I was starting out, and it was a lonely place, man. All the smokers would duck and hide every time I'd come near the building, and it's really exciting now to see that there are sometimes 2, 3, 4 tobacco champions at each of the tribal sites. It's really exciting. And I want you to really think about how to partner the tobacco, if you haven't already, partner the tobacco efforts with other health efforts in your community. If you can support a diabetes event with a tobacco message, or if you can support a WIC event, you're reaching multiple communities or populations within your community and really maximizing everybody's time and budget. When you're doing education and outreach, the quality materials that focus on our common values within a community can be really, really effective in reaching people. We also know the Moccasin Telegraph works really well in our community, so make sure you're telling good stories that go out there. Although we know the horror stories are the ones that get passed most quickly when we talk about things like the side effects with the Chantix or whatever. But when there's positive stories in your community about tobacco, share them, keep sharing them. Use social media, use Facebook, use Twitter, make sure you're telling stories. Find the storytellers in your community. We know who those people are that can really share a vivid story and engage them on these tobacco messaging and ask them to share that story. And again, work with your local media. In our small communities, that tribal media is powerful. We have access to media like you can't get in some other places. And so make friends with the radio show, with the newspaper editor, whoever you need to in order to get those stories in there and find out their deadlines, and so that they're ready to go when you have a story you want to get out. Well, that was an abrupt ending. So I just really am so excited again about all the work that's happening in American Indian communities across Minnesota when it comes to tobacco control. You are doing some really amazing things, and I hear every day, I hear more and more, and I'm just thrilled to see what is happening. So with that, we have just about 15 minutes left for questions. I think it may be a little crazy if we unmute all the lines. So I'm wondering if we could handle the questions in the chat box, and maybe Melanie can read them and we can respond as appropriate. I see there is a question or a comment here from Roseanne at Fond du Lac. Hi, Roseanne. Good to see you. The medical providers are not referring patients to community culturally appropriate tobacco cessation counselors as myself. I'm an enrolled member of my reservation, certified to provide tobacco cessation, but I am not being utilized. And that's pretty common. I think that what we've found when we're working with the clinic providers is that sometimes there's turnover, sometimes they're just not sure who to refer to, and sometimes they just aren't doing it. So there are a variety of issues, but we just continue, we try to work with them to make sure that they are aware of community-based cessation providers, and to show how they can, how you as a cessation provider can make their job as a medical provider easier. I would encourage you to continue working with them to figure out a referral system that works, perhaps. I think that's that with that question. So if anybody else has questions, we're ready to respond. I hope it was helpful. It was a little weird talking to my screen the whole time instead of all of you. I really wish I could have seen your faces, and I see some. Would have been nice to have you all in front of me in the same room. Thanks to you, Sarah, for helping to organize this. Okay, do you want to read that next one? Oh, so the question from Ida is, will there be some kind of conference or some educational plans in the future to new people like me? And I would hope that Lorraine or Sarah could answer that question. Maybe in the chat box. I don't know how to, maybe I can figure out how to. Oh, Lorraine says she will be in touch with Ida. I know with these webinars, as we are looking forward to providing additional webinars, if you have ideas on topics that you want covered, for sure, contact us, contact Sarah or Lorraine. And Sarah says, all in caps, we will absolutely be offering training in person and webinars. So we do look forward to seeing you all in person very soon. Maybe come spring, when spring will come.
For those that might be this is Melanie. For those that might be attending the point of sale training in March, Peggy and I will be there, and I think we'll be all sharing in some presentation material there. And then we do have a series of webinar topics planned upcoming, but we're always open to feedback, so please send any ideas. And thank you to those who have filled out the survey. We are taking all of that information into consideration when we're planning, hopefully, what is most relevant and valuable to you all.
Thanks, Melanie. There was a question about whether the webinar was recorded, and was recorded, and so it will be available. And yeah, and hi, Patty Thunderhawk was on the call. Will we have a list of people that were on the call today available to others? I guess that's another Sarah and Lorraine question. There's another question about, okay, so the first question, Sarah, was, is there a list of people that participated on the call, and will that be available to others? And there was another question asking if American Indian material is out there for them to take to schools, because most of the material is non-Indian. I know there are a variety of resources out there. We have a couple things here at the American Indian Cancer Foundation. I think Sarah and Lorraine have access to the other American Indian specific resources when it comes to tobacco. And Nicole asked if the one slide with the picture of the community healthy tobacco will be available, and that definitely is available. Print copies will be available very soon. I think it will be downloaded, or it will be on our website for you to be able to download in the very near future as well. And so
we do have print copies available now, and we'll be ordering more. And it would be helpful for us to know if that's something that you would like as a resource as a hard copy or electronic copy, but both will be available to you. And you can shoot me an email, or I can try and connect with you. But soon it will be available as a PDF on our website that you can download and print. And we have nicer copies available too that we can mail out.
Great. And I see that somebody, Patty, noted that CDC has native brochure that you can get as many for free. Clearway, Minnesota also has some, and there's the keepitsacred.org website has a number of materials, and so keepitsacred.org is a great resource. Great. Well, I'll do a little 10-second pause and see if we're ready to, but again, miigwech. Thank you. It's been a pleasure to be here with you today with so thank you.